Hi, my name is Kimberly Pajak, and I am the account manager for dental medical billing, and I work with many Healthy Start doctors to try to bill medical insurance on behalf of their patients. In order to make this a simple process, I walk you through the enrollment. We have a welcome letter that we send out that, sorry.
Okay, go ahead, but I'm gonna do one little thing. I wanted to move this.
I know Christine wants me to do one of these for her new website, and I'm like, ah.
You know what I'm going to tell you? Be warm and friendly and have fun. Because people, they're looking to you to solve their problem, and you're comforting them. Hey, I got this. Yeah.
Okay.
Okay.
Hi, my name is Kimberly Pajak, and I'm the account manager for dental medical billing. We help dental offices bill medical insurance for their patients. We especially love to work with Healthy Start because we love to help parents be able to afford their children's care. We do anything from check eligibility and benefits to claim submission to prior authorizations and appeal letter writing. We have, sorry.
Because I'm going to change something anyway. Hold on a second. I'm going to do this. Go ahead. I'm going to just.
Do you want me to talk about the fees for the service, or do you want me to leave that out for right now?
If you want to, what we can do is talk generically about the fees, because then I can put numbers up behind you. Because this whole side of the wall, see the way you're positioned?
Okay.
That whole side of the wall is going to allow me to put anything in there that we want to.
Okay.
And the other thing is if you would take that arm and just do this. Yeah. Because
both arms like that?
Do you gesture with that hand at all?
Not usually.
Okay,
no.
but either way, but I like that tucked in instead of like this.
Okay.
Because it gives us more room to work around your silhouette. Okay.
Okay.
Go ahead.
Hi, my name is Kimberly Pajak, and I work for dental medical billing. I'm the account manager. I partner with Healthy Start to help dentists bill medical insurance on behalf of their patients and their parents. This enables them to be able to more easily afford their children's care. We have a one-time enrollment fee, prior authorization, eligibility, and appeal letter writing fee, and a claim fee. We do anything from check eligibility and benefits, do the prior authorizations, submit the claims for the doctors, and follow up on all claims so we can involve the offices as little or as much as they would like to be.
Okay, I want you to do it again. And this
I know,
time,
every time I change it because I don't have a script.
Oh, of course, and listen, this is what I do, and every time I do it, I change it too.
Because I actually like the first one better, but then I forgot all the things that I said in the first one.
And so some of this may be edited together, and
Okay.
I don't know if you have a logo, but the first thing I want you to do, see, you were just laughing and having fun.
I know, very serious.
Yeah, and this, what I want you to do is just smile and say, hey, I'm Kimberly. I'm blah, 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 blah. Yeah. Okay, go ahead.
Hi, my name is Kimberly Pajak, and I'm the account manager for dental medical billing. We bill medical insurance on behalf of children and parents for Healthy Start all over the country. We love being able to help parents afford their care for their children, as I am myself a mom, and I can see the value of what Healthy Start brings to these kids' lives.
Give me the process now. Tell me, let's just say I'm a brand new doctor. It's day one and I've got my first case. I don't know what to do. How do you step in and help?
Okay. So when you sign up for dental medical billing, we enroll you in our electronic billing service, and we have a couple different ways that you can get the information to us. Either setting up a remote desktop with your IT people, which is the way that I prefer, because that means that your office has little involvement in the process and gives you more time to spend with your patients. Or you can fax the information over to me or send it to me in an encrypted email for HIPAA purposes. Once I receive the information, I always like to check eligibility and benefits, check for prior authorization necessity, and then if everything is ready to go, we submit the claim at that time. I do everything for you as far as enrolling you with the medical insurance companies, getting you credentialed. Doesn't mean that you participate with the insurances, but a lot of insurances require some additional credentialing because you haven't submitted that to them before. So we take care of all of that for you and try to make it as an easy of a process as possible.
Okay, you gave them a couple, they can fax something, they can email something, or they can do something online?
Right, set up a remote desktop.
Okay, so I want you to say that again, and I would start out like the least desirable, I would guess, is faxing it. Next would
Right.
be emailing it, but you've got something that's really already designed to work with them, and it's an email system. I mean, it's an online system, and by the way, you're looking at me, not the camera. It's okay, I mean, it's okay.
Am I supposed to look at you, or am I supposed to look at the camera?
No, you're
Okay.
looking at me, because you're talking to a real person.
Okay.
You know who the camera is? The person who's looking at it online or looking at it like this. They're incidental. They're
Okay.
kind of like part of the conversation. You don't want to pretend they don't exist, because that's why you're doing it. But the main thing is you're talking to me. So so you can initiate all of this by sending a fax,
Yep.
sending me an email. But the cleanest system is to take a minute and get it set up online. This is how we do that.
Okay.
Okay.
So we have a few different options for when you sign up with us. You can fax the information over to us. You can send us an encrypted email, or the way that I prefer to have it done is for you to have your IT people set up a remote desktop for me to use. I have a cloud desktop on my computer, and so it's all very HIPAA compliant as far as nothing is actually stored on our computer systems. Everything is in the cloud and password protected, so that if anything ever happened to our computer system, everything would be very safe up in the cloud.
So I, as a doctor, want to interact with you in the same safe environment of the cloud. So you're going to set up my computer so that I can communicate through the cloud?
Correct. Well, correct. Your IT person would set up a remote desktop on my cloud so that I would be able to come into your computer system. And because I have 15 years as a dental assistant, I'm familiar with many dental softwares, and you can give me as much or little access as you would like to the records. Mainly I need chart notes and fee schedules and demographic information for the children.
Okay, so now it makes sense. At first I had no idea what the heck you were saying.
Okay.
So let's just say this is patient number 1. I've got all the information. I input it into my system, and I say, hey Kim, I've got something. Bam. You come into my computer and navigate to grab it?
Correct.
Okay, cool. So can you describe that kind of, or maybe I'll just use my own question in
Sure.
here. Does that sound reasonable for me to use my own question? I just input all the information on my new patient. I'm going to notify you that they exist. You come in, retrieve it, utilize it, and go into claims motion.
Correct. I try to make it as easy as possible for the offices to bill the medical insurance and get the highest reimbursement possible for those claims.
What if I have multiple doctors in this practice or multiple locations?
I do have a doctor who has 6 locations, and what we would need for those practices is the tax ID number that you use for each practice, or if you use one tax ID number for all practices, that would be fine. And then the MPI numbers for each doctor that will be submitting cases to the medical insurance.
Okay, on the system, do we have a format that requires that I fill in all required areas so that I don't leave anything out and I know I've communicated fully to you?
Yes, as part of your training and your one-time enrollment fee, I will teach you how to do the SOAP notes and what's required for medical insurance, as medical insurance requirements are much different than dental insurance requirements.
Well, I'm not even a good patient, but can I play a doctor on TV and do the dummy enrollment with you so that we can demonstrate to other doctors how it's going to be set up for them?
Sure.
There was some reluctance.
Well, I wasn't sure if you were asking me that outside of the camera or on the camera.
I'm asking you on camera. So, because people are like, really? But what does that look like? And how do I do it? Okay, so let's just say I'm ready to go. I'm a new doctor. I say, hey, Kim, I was told to call you because I'm going to start submitting cases. What's the next step?
Okay. Thank you, doctor. What I'll do is I'll send over to you a copy of our contract with our credit card on file authorization, a copy of our HIPAA form, BAA that you would sign and I would sign, that says that we both understand that patient protected information is transferring back and forth between the two of us, and that will be protected on both ends. And also I will send over an insurance verification form that the patient would sign, letting the patient know that we are billing medical insurance on their behalf.
And this is better than an email or a fax because it is on the cloud, which means I can go to any computer if I'm on vacation or if I'm away from my office. I can access it through the proper sign-on through my cell phone, through my office desktop computer, through my laptop, through an iPad, through any form of digital communication, and still everything stays within that HIPAA-complied, secure iCloud position.
Correct. So, so I only have, there's only one access to the cloud on my computer, and you have to sign into the cloud to receive that, and nobody else would have access to it. I actually physically have to go into one of your computers though, so you have to set up at least a laptop that I could go into all the time, preferably one that somebody doesn't use. So the different offices that I work with have a variety of different ways that that's done. Some use cloud-based software already for their office, for their practice management system, and then some offices just give me access to a computer that they don't really use very often.
So somebody has a designated computer where all of this is stored that you access on demand when a new case is submitted, and I, the doctor, can add information to that from any device I want, but it's only one computer that you're going into to retrieve it.
Correct. I do have one office that doesn't have me do a remote desktop, but we do a OneDrive for Business folder where that office drops all of the information into this OneDrive folder because OneDrive for Business is HIPAA compliant.
Is there a reason that one office would choose that over the system that is more often used?
Offices have just a personal preference with regards to how they want that information to be accessed. Some offices that may have had some breaches in their security prefer to do the OneDrive for Business folder or to fax me the information. I use a internet fax, which is very safe to get that information. It's just all the personal preference of the office, but I prefer the remote desktop because it makes it easier for me to come in and get anything. And if you forget to put something in the OneDrive folder, I have to call you and then wait for you to put that information into the system. Whereas if I have a remote access to your computer, I'm able to come on my own, get the information that I need, and get back out without bothering anybody.
All right, two things. Fair to say that any method that is chosen by a doctor's practice and you is going to be a safe and secure communication platform.
Correct. We strive to be the most HIPAA compliant that we can possibly be, as we understand, that safety of patients is our top priority.
And how long have you been in this business?
I've been doing medical billing for about 2 years now, and before that I was a chairside dental assistant for 15 years, which makes me very familiar with how dental offices work, how doctors think about their practices, and how the office runs. And
there is no way that anybody would spend any time being concerned that you could see anything else in their computer beyond the window of information you're looking for?
Correct. Most practice management softwares have restrictions that you can put in place based on the person signing into the computer. I prefer that the office makes my logon and password name for me so that they have a copy of the name and also the password for their records, and that they're able to restrict the access to their computer the way that they want it to be. I don't really want access to financials or the ledger unless I'm looking for a fee schedule, and really I prefer the fee schedule to just be sent to me as a hard copy so that I have it for my records.
Wonderful. Okay, so beyond the logistics and dynamics of communication and security, tell me just in practical terms what the day is like since you have all this experience working in a dental office. You just finish a case, and then what?
So then you would just let me know what the patient name was that you were submitting for, why you were submitting for it. We would have previously spoken about SOAP notes for the patient and required documentation that I need for those cases, either letters of medical necessity or sleep studies, depending on what you're diagnosing the child with. If you don't know the diagnosis code, I just need the diagnosis and I will code it for you. So you can have as little or as much knowledge as you want in the medical billing as far as that goes.
Okay, so I'm assuming that the doctors will all know what soap notes entail and how to deliver those in a completed form so that you're not looking at it saying this isn't going to satisfy the requirement.
Correct. So what I do as part of my training with the offices is we talk about soap notes. I give the office an example of what a soap note looks like. Most of them probably haven't written them since dental school, as that's not a requirement for dental insurance. But I also will look them over for you, and I'll give you my thoughts on any additions or subtractions that should be made to those notes. But for me, more information is always better.
So if you have a medical doctor or a dental practice that's ready to get started with you, they need to have their staff ready so that when you put them into the training and introduction kind of introductory conversation, is this done like on a video? Is it done like on a webinar? How do you communicate the training to this office?
Usually it can be done either through a phone call or a webinar, some kind of a Zoom meeting or GoToMeeting. But most of it I can do with the offices over the phone in a quick conversation, and then I build on the training as we go through the process, because I find it's easier to train on the real life cases as we go along, and then eventually, we have the system down pat.
Can you and I be able to do something like we're doing a mock? I'm an office and this is what I've got. I mean, I could even go into an office and say, hey, let's use your office to set it up so we can demonstrate even to our patients that this is, you're not relying on me, the doctor, who only knows teeth and care about insurance. We've got a real specialized third party that's partnering with us. And let me show you how they're set up. I mean, could we do that and then?
Sure.
Okay, cool. So
well, you have a couple of Healthy Start doctors that are in my program, Dr. Marino and Dr. Harrell.
I don't know Harold yet. I met him in Chicago. Marino I know really well.
So
but he's already done it. Did he do it, or did somebody in the office? Did Kim or?
No, he has. He had the woman who I was originally working with left the practice like right after I started, and so I believe I'm working with I think her name is Heather.
Yeah, there's a Heather there.
Yeah, absolutely. So I'm working with Heather, but they use a cloud-based software, so I'm able to just log into their system through the cloud and get the information that I need that way, so there isn't a remote desktop for that.
All right, if I were to go to one of the two doctors that I know pretty well in Houston that would be great to work with,
sure.
Then maybe we could do that because it'd be brand new. So if somebody's going to make a mistake, typically where's it going to be? They're going to drop the ball or miss something, it just didn't occur to them. Where's that going to be?
Well, mostly the biggest pushback that I have from most offices is just not the time to get me the information. So, for example, I have a Healthy Start doctor in Alabama, and they are so overwhelmed with the amount of work that they have to do that it took them about 3 weeks to get me even started with the information that I needed to do for a few cases for them. So, what I want to assure offices is that it's not as hard as it seems to be. I try to take a lot of that burden off of you by the remote desktop, and all you really need to get me is the patient names, and then I can walk you through, each case individually. But generally I just need, 10 to 15 minutes of the office's time, and that's sort of where I run into some issues, is just that time to speak to me about what we need to get started.
Okay, so we're going to set this up, and we're going to do it on a Zoom meeting, and we're going to record it. And does it have to be the doctor, or could it be the office manager? Who should it be? Should it be everybody present?
Well, the office manager probably would be great. The doctor as well is usually helpful. Most conversations that I have with offices usually start with the front office or an office manager, but eventually lead to the doctor, because they, with the soap notes, they just want some guidance with how to do them, what's required, what I'm looking for, what they're looking for with regards to what qualifies as a medical insurance case, because not all medical cases qualify for medical insurance. Medical insurance wants to know about medical necessity. They don't care about teeth. All they want to know is how this is going to help the patient's overall body, not just their mouth.
Okay, and so do you do the dental and orthodontic as well, or is it just medical?
I mostly just do medical. I do work for an orthodontist here in Massachusetts that I do his dental and medical billing for, but generally it's just medical.
Okay, so if that's the case, would you prefer just doing medical, or are you open to accepting the orthodontic?
I prefer to just do the medical at this point because adding the dental in there makes it really hectic.
Yeah, I would agree.
I
So-
probably have about 10 to 15 offices signed up to do medical billing right now, so you know, just sticking to medical I think is where I'm comfortable.
Smart. I'm not even going to give them the option. I will not confuse your life that way. I would never do that.
I'll never see my children again.
Yeah. No. We don't want to do that.
And I work from home.
Okay, so how long does it take to get a case processed, and does it depend on the insurance carrier as to their turnaround time with resolution?
Correct. Generally, it takes between 30 and 45 days to get a case processed, and then if we go into the appeal process, it can take another 30 to 45 days to process through that case.
How often are you refused and have to appeal?
Not too often. Mainly, it's when I have to prove medical necessity, so the diagnosis code isn't what they were looking for with regards to that appliance. That's usually when we run into the appeals. Also with the children, they want to make sure that it is medically necessary treatment, so I usually recommend that if possible you get a letter of medical necessity from the patient's pediatrician as part of your case submission.
Kim, do you realize how damn good you are when I ask you questions with things that you wouldn't have thought to tell me? So, I mean, could you...
I know, I need to be like led though.
Yeah, but that's okay because this is so helpful because you're going to answer these questions one time instead of all these people. So this is really valuable for us to go through it. So do you have a list of FAQs that will help that people can do? That we have like a landing page on our website that says frequently asked, you know, of our medical insurance department or whatever we call it, or partner?
Sure. I believe Jan and I were working on a list of frequently asked questions, so I can get that over to you.
Okay, that's great.
For the website.
Is there a limit to how many doctors you can provide this for, or the number of cases, or do you get it to a streamlined thing?
Right now there isn't a limit to the number of cases or doctors. We can always add on more staff as we need to you know, continue through this process. But right now, even though we have other people that work with us, mainly you would be speaking to me first to get enrolled, and then we go from there.
I know that the company is really anxious and interested in doing something for their providers to simplify the process, but also to apply economy of scales so that they can do this at a little bit more affordable rate. Is that something that you think is going to be a real advantage and attraction for our doctors?
Yes, I would love to work with Healthy Start to streamline the process and make it affordable for everybody, as our number one goal is to make this easy for the doctors, the patients, and their parents.
Is there any way that we could do something that would communicate to the parents that this has been provided by somebody with a, you know, tremendous expertise? I don't know that there is, but if you can think of some way,
Sure.
I think it'd be great. Something like a paragraph of we are working with you, the parent,
Sure.
to help provide a part of this, which is essential, and that's how it's going to be paid for. This is what we do to support your family's finances.
Sure.
Okay, cool.
Yep.
All right, let me think if there's anything I'm going to like go, man, why didn't I ask that? We said 4 to 6 weeks. Is that what the turnaround time was, or 45 days?
Correct. It's
Yeah.
usually 30 to 45 days, and it can take anywhere from 2 months to a month to get set up in our system. It just depends on how fast the information gets to me. And then if the insurance company requires additional credentialing, it can take anywhere from 15 to 30 days depending on their policy for that additional criteria.
What if how many different carriers do you currently work with in seeking coverage?
Well, right now I have doctors all over the country, from the East Coast to the West Coast. I have offices in Massachusetts and Virginia, Iowa, Illinois, Alabama, California. So
do the laws of an individual state come into play for this?
yeah, so for example, the best one that I like to use is Blue Cross Blue Shield of Illinois has a corporate policy that discludes implants from being covered regardless of the reason, unless there's a specific clause in the contract that allows it, or if the patient had an accident within the enrollment period of that patient's insurance.
So if we're saying what is covered, is it fair to say it depends on the state that you're in and the policy that you have?
Correct. Every policy, every state has different criteria for what's allowed and what's disallowed. Every insurance plan individual has different deductibles, co-insurances, and out-of-pocket maximums. Some insurances allow you to do in-network exceptions. So if you're an out-of-network provider but there's nobody else in your area, it's within 50 miles of a patient's home that participates with that insurance and provides the same service, then sometimes they will allow you a gap exception for that insurance so that you could receive that care at an in-network rate.
That was good. You know what I think, Kim, is that I need to take my questions and put them, and then your answer be the FAQ. So the online
okay.
FAQ.
Sure.
Okay, so is there any state or area that if I'm a doctor, I'm going to say, hey, Kim already told me I'm not in a good position to work with insurance. Is there any area that's just not friendly or receptive to providing?
I haven't encountered any specific areas, although doctors who participate in Medicaid and Medicare specifically need to find out what the rules are for their state with regards to billing certain appliances that we're doing in the mouth. Because some states have really open policies with regards to those procedures, and some states don't allow those procedures to be billed through Medicare and Medicaid.
Okay, so how do you do, I mean, you handle the primary carriers, but you also do Medicaid and Medicare.
Correct. Along with my partner Jan, we have been researching Medicare and Medicaid through all 50 states, and we're working one state at a time to try to gather the information with regards to Healthy Start in that state.
So if I'm a doctor that has a Medicaid, clientele, and I reach out to you and say, hey, I do Medicaid, can you help me? Then how long would it take for you to ramp up and be able to address the cases in those states?
If you have a question with regards to Medicare or Medicaid in your state, I'm happy at no charge to research your state for what would be payable as with regards to Healthy Start for that particular state.
Okay, and how about self-insured?
For the self-insured, that's different for every state and every insurance carrier, but in order to provide that service, it would be part of your enrollment process. Medicaid and Medicare is very open to sharing the information as long as I have an MPI and tax ID number for that particular state, a doctor that practices in that particular state, they're able to share with me their reimbursements for certain codes. But in order for me to research all insurances for the whole state would be nearly impossible. So I'm happy to do that as we go along with your enrollment.
This is probably a really dumb question because I'm not in this business, but when the insurance is paid, does the money go to the practice or does it go to the policyholder?
My experience state to state has varied. I know Wellmark Blue Cross Blue Shield in Iowa, they pay the patients when it's a non-participating provider. So what I tell offices that I work with is more than likely the insurance company is going to pay the patient, not the provider, as they don't participate with that insurance company. But I also know that Blue Cross Blue Shield of Alabama pays the provider and not the patient. So my recommendation is always to either have the patient pay in full at the time of service, or have a solid financial arrangement in place so that you're not out the money. If the patient gets paid, that they have the money and the appliance and you haven't gotten paid for anything.
So most doctors, I think, have them sign some kind of a waiver or disclosure saying that they will not cash a check because it is to, in fact, go to the medical or dental office, and then applied to the cost of their case. Does that sound like the kind of arrangement that you see happening, or?
One of my offices that I work with, we decided there was a particular patient that wasn't able to afford the treatment at the time of service, and so what we had come up with was she left a credit card on file, and if insurance paid her directly, she had 10 days to then pay the office, or they would charge her credit card for that amount.
And was that agreeable to your setup?
Yes, that's
Okay.
fine. My ultimate, I mean, I'm not in the office to do the collections, but my ultimate goal is to help offices increase their, production and collection, and not be out a lot of money on their end, because, then that requires a person from their office to then try to collect that money from the patient after the service has already been delivered.
Okay, sorry. Were you going to say something else?
Oh, I was going to say because medical insurance requires that we bill on seat date, not on start date. So you've already delivered to them the appliance, and now they've received the money, and maybe you got paid and maybe you didn't.
What is the seat date?
The date that the appliance was delivered.
Okay, got it. All right, so I'm going to just just talk real here for a second. If I am a doctor, I'm listening to you, I'm completely convinced I don't want anything to do with this, take it. Please take it. I'll wrap it in a bow and send you a Christmas card. Take it. You worked in an office. Is there any reason that a doctor's office would say, I'm smarter to do this on my own than let you guys handle it?
I mean, if you had an insurance person who was just specifically doing dental insurance and medical insurance, and that was all that they wanted to do, then specifically I could see that the office would keep that in-house. But if you're an average dental office who doesn't have the staff to even do dental insurance sometimes, then outsourcing is generally the best option, because there are a lot of things involved with billing medical insurance. But our company does offer a few different things if you are interested in taking the billing in-house. We have courses that you can attend, 2-day hands-on medical billing courses that you can attend. And we also have staff that comes into the office for 2 days and personally trains you on how to bill medical insurance.
If you are the spouse of the dentist, I can see saying that's a good option, but there are people who move on. And so
Right.
put a lot of training and expense. So if I'm looking at, if somebody is being paid in my office, there's a salary tied to it. That salary is probably no less, maybe no greater than what I'd be paying you, and I'd be paying you on a per case basis almost, if it were, or if I was doing it in the volume monthly bundled package. I just know it's not an additional fee for me to consider. What's that number going to look like?
Correct. I mean, obviously my choice would be to have you do the outsourcing, because I think that's the easiest, most affordable way for offices to get these appliances billed out to medical insurance. But like I said, if you chose to take it in-house, there are those options as well.
If I'm looking at somebody who does it in-house and I see that they make a mistake, it's going to cost me time, and financially that's going to add stress in my household. How often does somebody make a mistake? Because there's just a very complex system.
Correct. I mean, if you were going to take it in-house, I definitely would recommend any of these courses that I previously spoke about, but there is a lot involved with medical insurance, and my experience has been a lot of the offices that will take a course, they'll go back and the staff is already overwhelmed, and so they just aren't able to keep up with it.
Okay, so here's my solution. Okay, this is from the other side of the camera. I draw a line down a piece of paper and I put a tooth on one side and other on the other side. If it has anything to do with the tooth, they can handle it. If it's outside of that, you handle it. Make sense?
Yes.
Amen. Thank you, Kim. I think this is going to be good. Nothing else that you can think of? How to get a hold of you, how to get started, what's the first step?
Sure. So you can reach out to me through my cell phone number, which is 508-954-0527, or you could email me at kim@dental dentalmedicalbilling.com. Either one of those ways, I will get back to you within 24 hours to set up a meeting to discuss our services.
You're in the Eastern time zone. What business hours do you keep that people would be able to expect to, it's not an obscene time to reach out to you or call or?
Sure, I am on the East Coast, and generally I do try to accommodate all time zones because, I understand that the West Coast is, about 3 hours behind me. But generally, if you speak to me in the evening, my kids are usually home, so I just usually need a little bit more patience or a set time that we could speak. It's hard to just reach out to me, later on in the evening on the East Coast.
And if you're not available, something happens that takes you out of the game for a minute, who else is there to fill in?
So I also work with Christine Taxon, and she can be reached at ctaxon@links, LINKS, the number 2, success, SUCCESS.biz. And she is an expert in medical billing, and she will be happy to help you as well.
How about, is Jan Palmer a part of this?
Well, yes and no.
I have no idea how this is structured. I don't know if we should include her name.
She had, well, she doesn't want to do any of the medical billing. She wants me to do all of that.
Okay.
So she was mostly involved with helping you guys with the lecture part of it.
Oh, by coming in and answering questions.
Correct.
Okay, got it.
But when it comes to actual business of medical billing, she refers them back to me.
Okay, so but in the case of two people getting sick, there is a third person?
Correct. So you can also reach Jan Palmer. Her email address, I believe, is jan@dentins.com.
All right, and you would reach Jan, you'd reach out to her only if you wanted what?
Only if you needed to, if you weren't able to get a hold of Christine or I and you had a pressing question that needed to be answered right away.
Okay, got it. I'm just curious, this is not going to be shared, but just from my own, which insurance company is the most agreeable and cooperative to provide coverage, to actually say, yeah, that makes sense?
Generally, I usually have the most success with any of the Blue Cross Blue Shields because they just are bigger and they seem to be more open, but they have certain restrictions. I mean, any of them really, Cigna, United, Aetna, I mean, they're all pretty agreeable, but my biggest insurances are generally the Blue Crosses.
Okay. Do you see any of them having smaller amounts that they'll do, or is it kind of uniform? I don't know if the industry is, that they try and stay somewhat in alignment. That might be collusion. I don't know. Monopoly. I don't know.
No, they're all different with their reimbursements,
Okay.
and it also depends if you want to be a participating provider, and accept their write-off, or if you want to be a non-participating provider and, receive your full fee. Some insurances negotiate rates, and if you have if you receive a rate negotiation sheet, I'll show you how to navigate that process, because they go back and forth with the fee that they're willing to pay, because obviously they would like you to take a lower rate, and if you accept that rate, you're not able to charge the patient the difference. So if you receive a rate negotiation, we also help you with that process as well.
That just came out of the blue. I mean, what other secrets do you have?
I know, oh
in there,
my
Pam?
gosh, you just came across that one by accident.
Okay, so tell me again in real simple terms what the heck you just said.
Some insurance companies try to do rate negotiation with you as a non-participating provider. They offer you a certain dollar amount for your service, and you can agree or disagree to take it. My general negotiations with them is not less than 10% of your actual fee. So when that sheet comes in, I usually have offices cross off the number that they offer, subtract 10% from their actual fee, and write that number down with a note that says, we do not accept less than 10% of our fee, and send it back.
Okay, so what this amounts to is you go to a dentist's office and you say, do you take my insurance? Oh, I'm sorry, I don't participate with them. They're a non-participating Is that what you're telling me about?
Correct. Well, most dentists are non-participating providers with medical insurance. But what I do recommend some offices, if you have a particular insurance that's all that you have in your practice, whether it's a Blue Cross or a United or a Cigna or an Aetna, that you consider participating with them, because then you'll know what fee you're going to get back from them. And then you would be able to use that as a marketing tool in your area to say, hey, I participate with this medical insurance, so if you require this device, we can get it covered for you through medical insurance.
I kind of wasn't even listening to you. I was thinking about something else. I gotta tell you this. Remember Enron went down, right?
Yes.
Okay. So I was working for a company called PEO, Professional Employment Organization, and I had a large company, and we were caught up in a lack of balance in, what do they call it, undesirable adverse, you know what I'm talking about, adverse selection.
Yep.
Okay, so the insurance company dropped us. I mean, overnight we were dropped. We had to go find another carrier to cover these people that had been paying their premiums, every single day of their employment and employers, both sides of the equation. We ended up pulling something out of the Northeast, and I believe it was an Indian, like an American Indian kind of self-insured program that
Sure.
they allowed us to step into. They would not care. They would not pay for the birth of a child for some girl that worked at this company. I later ran into her. She said, "Do you know that you came into our company and we got stuck with that insurance? I had to pay out of pocket for the birth of my child. We had complications, blah blah blah." And I'm like, kind of like Enron, you can't blame the receptionist.
Right.
I didn't have anything to do with any of that, but I certainly understand how painful a reality they were hit with. So
Right.
what are the odds of anything ever happening that are weird like that you wouldn't even think about connecting to?
Well, I only know of one particular case. Recently, an office that I work with called me because they were going to have a patient come in who had been in a logging accident, and they were asking me what kind of information they would need to collect from the patient before he came in or when he came in for his visit, which from my end was an accident report that needed to be filled out by the patient in his own hand, specifically describing what had happened to him in the accident and what damage it had caused him. And so I sent that off to them, and a couple days later I followed up with the front office of that particular dental office and was told that because the employer, he was the owner of a logging business, because he had missed, they said $140 payment to them for his premiums. When he had his accident, they dropped him from the insurance, and they refused to cover any of the cost that came from him having this logging accident. So specifically, I only know of that one case, but that's pretty bad.
That's pretty bad. How bad was the accident, and what kind of?
My understanding is that he was in intensive care for quite a long time and had damage to his face, had some reconstructive surgery done to his face, which obviously affected his teeth as well.
So don't you think that it would have been?
So now it's all out of pocket.
Yeah, but why didn't that company send him something saying, be forewarned, you no longer have coverage in the event of a catastrophic event, and so you best be careful or find a provisional,
Currently,
gap
I believe
policy.
he's consulting a lawyer with regards to that particular policy.
Yep, I can imagine. Okay, I can't think of anything else, Kim. I think this is great. I really
Awesome.
do. I think that Leslie is going to look at this and go, oh, it was a good thing that you came today, because we've got enough material here to give them a real good.
Because you'll just edit it and kind of like pull it together with.
I'll just say question, answer, question, answer, question, answer, and it'll probably be like on that margin.
Okay.
You'll see the question, and you can push the box, and it'll be your response.
Okay.
See the question, push the box. See the question, push the box.
Sure. And I'll go and check and see if there are any other FAQs that Jan and I had come up with that we didn't answer today, and then maybe you could, instead of my verbal answer, it would just be a written answer as well.
Yeah, written is fine. The only thing, because I was going to say, we could even do it like, in a Zoom meeting and get your answer.
Right.
It's just that the audio quality will never be identical.
To
And so,
today.
Yeah. I mean, it's not that this is good.
Right.
It's just that
I
it
just
would
wasn't
be-
thinking about
yeah.
that, so I didn't bring the list with me.
How many providers do you guys have? How many insurance companies? Like 5? I mean, primary, I think you mentioned,
It's usually Blue Cross of whatever state, Aetna, United, Cigna.
Cigna.
And then we also have some offices that do the TRICARE for the military.
Oh, okay, yeah.
And then in California, unfortunately, they have Kaiser.
Okay, how about Pacific? That used to be a provider of medical
I
insurance.
don't have anybody who currently is billing to that. I know Blue Cross Blue Shield of California, there's 2 of them. One of them is more difficult to deal with than the other as far as the credentialing goes. And Kaiser is more difficult because it's more of an HMO type plan, and you need to have a referral from your primary care to that specialist in order to have them even consider coverage for that.
So that means pre-qualification is a necessity, and if a doctor's office doesn't know that, somebody gets care and they didn't do that, and then now the expense falls back on them?
So
Whoa.
mostly I bill only PPO insurances. HMO insurances are more difficult to manage, and I have not successfully billed an HMO at this point, just because they require so much paperwork previous to the claim. You have to get a referral from their primary care, but the primary care has to put through the referral, the diagnosis code, and the procedure on your behalf, and I just find that medical offices don't see the benefit to them to help us with those patients' claims. So I have found it very difficult to deal with primary care offices with regards to referrals for an HMO.
Okay, PPO is, method of choice to provide insurance.
Correct. I mean, generally I would say if you have an HMO, I don't even really consider doing it unless you had an extenuating circumstance with a particular child, whether it's a disability or what have you. There's nothing that makes a medical office, there's nothing in it for them, basically.
And so there's just too many obstacles and hurdles if you're going to do HMO.
Correct.
How about in my community, for instance, there's a hospital chain, Methodist hospitals, and my insurance is through them, my health insurance. That's not one of the big 5 that you mentioned. So how about when you deal with those groups?
So usually if I have a small insurance company, I definitely recommend eligibility and benefits and prior authorization checks before you start any treatment, because at that time they tell me whether it's even possible to bill that insurance company for that office, because I automatically always tell them when I first call that I'm calling for out-of-network benefits for a particular office. And so I try to find out at that time if it's going to even be possible to bill that insurance company. And generally the smaller insurance companies require prior authorization, so we do that process and then they let me know for sure whether or not they're going to pay for that service.
Send me something that says this is what prior authorization really entails so you don't miss something.
Sure.
And if there is no coverage because my Methodist hospital plan doesn't provide for that, what is my next recourse? Pay everything out of pocket, or is there a government fallback safety net of any kind?
No, it's generally would be to just, if we go through the whole appeal process and the insurance company still denies it for whatever reason, whether it's that it's just not a covered benefit under your plan or they don't consider it to be a medical necessity, there isn't anything else that you can do at that point except decide if you would like to pay for that service out of pocket.
Got it. Okay, we're done.
Okay.
Can't think of anything. Are you exhausted, man? That was pretty intense, huh?
Yeah.
Sorry about that.
That's all right.